Hi, my name is Dr. Andrea Smith. I'm an OB/GYN and I practice at the Salt Lake Clinic and at LDS Hospital. First moment I wanted to be a doctor, I don't remember the exact moment, but I remember I was very young, maybe as young as 5 or 6 years old. I've known since grade school that that's what I wanted to do. I didn't know what kind of physician I wanted to be, but I definitely knew I wanted to be in medicine. So I've been out actually 22 years, if I do the math, and so there have been a lot of changes. And so I transitioned over the years now where things are done so minimally invasive. We put a camera inside, small skinny instruments, and even progressed to the point which I do, which is adding a robotic assist where you get robot arms to help move and maneuver that camera and those instruments. So it has gone leap years ahead of where I started. We can provide a much better service for the patient, a lot better recovery, shorter hospital stays, fewer complications. So that part has been really exciting. My personal philosophy of care is to try and take care of each patient as the individual that she is. And I also like that in this day and age, patients work with us and communicate with us and become part of the team to come to their solution to their health care so that they do feel empowered. And I hope that they do in my office, and they seem to because they'll speak up often and feel empowered to make sure that we're creating a plan that addresses their concerns. The message that I would want my patients to understand is that I'm not looking for anything else than to help them. At the end of the day, I really have their best interests at heart all the way through. I know that there's many times there's some distrust in the medical community, and I understand why that has occurred at times. But for the majority of us, and myself specifically, I don't have other goals in mind when I'm taking care of the patient except to just get the best outcome for her and for her baby too if she's pregnant. Some of the events that occur that make me reflect on back that I made the right choice. Sometimes I am running around from room to room to room on labor and delivery, delivering multiple babies at the end of the day. And no matter how busy or how crazy or even stressful it is, I realize I'm running around with a smile on my face. So for whatever reason, that excites me and I like that. And those are some of my best days. One thing that most patients won't know is that while I deliver babies in my daytime work, for the last 4 years, my volunteer work was at a goat ranch during their kidding or their birthing season. So I've delivered lots of baby goats. To unwind, I usually choose some physical activity many times, hiking, biking, swimming. I also have pets at home, and so sometimes we just sit quietly and watch a movie too.